The management of patients with nasal polyp syndrome or chronic rhinosinusitis with nasal polyps has been transformed over the last few years. We now know so much more about the disease and its underlying pathology. We can chart the disease using biomarkers, but the game changer has been the advent of biologics or monoclonal antibodies. As more of these drugs come online, which is the most efficacious? That is what we intend to find out in this show. This is EUFOREA News, broadcasting from London. Hello and welcome to EUFOREA News. I'm Dr. David Bull. Nasal polyp syndrome, or chronic rhinosinusitis with nasal polyps, is predominantly driven by type 2 inflammation. The biologics Dupilumab, Mepolizumab and Omalizumab target the underlying inflammatory processes. They target the drivers and mediators of type 2 inflammation. That's IL-4, IL-13, IL-5 signaling and IgE respectively. All of these three biologics have been proven to be efficacious in treating the condition. But the question is, which is a better drug to use? Direct comparisons between the three biologics are rare. So this prompted the EVEREST Trial, which stands for Evaluating Treatment Responses of Dupilumab versus Omalizumab in patients with severe CRSwNP who had mild or severe asthma. It is the first head-to-head comparison of two biologics. Now, the trial was an international, randomised, double-blind phase 4 trial, which was conducted at 100 hospitals or clinical centres in 17 countries. Patients had to have severe, uncontrolled CRSwNP, symptoms of nasal congestion and a loss of smell for at least 8 weeks, and asthma. Well, my first guest to talk us through this trial is Professor Eugenio De Corso. He is the EUFOREA CRS EPOS panel co-chair. He's also Professor of Otorhinolaryngology at the Catholic University of the Sacred Heart and an adjunct professor in ENT in the Institute of Otorhinolaryngology, A. Gemelli University Hospital Foundation, or IRCSS. Eugenio, really good to talk to you once again. Let's look, though, at this EVEREST trial. What aspects of this trial do you consider particularly intriguing? As far as I can see, it's the first head-to-head comparison of these two drugs.
Thank you very much, David. This is really an interesting question. You know, we were having only the indirect comparison, so we had a gap in the literature because they are considered not reliable. From a statistic point of view, they are very, very interesting methodology, but the head-to-head trials are finally superior to indirect comparison. So it is what we need to compare biologics. I think this is interesting because and is intriguing because it's the first one in nasal polyps patients, but even more is more interesting because is investigating the population of nasal polyps combined with asthma. So this is the first time that we are considering in a trial the nasal polyps and the asthma as the expression of the same systemic disease, and this is the first time that we are investigating one drug and analyzing the outcomes in the lower and upper airways. This is really intriguing.
So in terms of this trial, the data that you then got, was it surprising?
Okay, so when we designed the trial, it was supposed that Dupilumab was superior to Omalizumab. So I cannot really define these results surprising because it was something that we were expecting. But anyway, the combination between rapidity and magnitude of response of Dupilumab compared to Omalizumab, even if expected, was quite surprising for me because the rapidity in terms of nasal polyp improvements and also of smell improvements was nominally evident already at 4 weeks. And you can see the same difference in terms of lower airway outcomes. And what is really interesting and surprising is that the superiority of Dupilumab is evident for all the outcomes that have been investigated for the nose and all the outcomes that have been investigated for the lower airways. And this is really interesting because this multimodal evaluation that has been performed in the trial for upper and lower airways was really complete, and this is really in favor of Dupilumab in terms of efficacy.
So, Eugenio, moving on from this, what would be the next trial then that you would like to design?
The ideal one would be the one comparing all the biologics all together in the same trial. And so all the available ones, so Dupilumab, Omalizumab, and Mepolizumab in the same trial, and even longer in terms of follow-up time. So it would be interesting to compare all the biologics available, and for a long time, even the comparison at 1 year and also at 2 years would be interesting in terms of evaluation of the rate of recurrence and sustained control that you can achieve with each of these biologics as well. And it would be also interesting to analyze the results even in the population without asthma, because in the EVEREST trial, we had analyzed the data for the patient with asthma and nasal polyps. But I would be even more ambitious, and I would like to have a trial also including the new available and promising drugs in terms of treatment of nasal polyps and asthma, such as Dupilumab and Epimocimab. But this is really difficult to do, and let's look at the future and what we can do on that.
And finally, if I may, given this trial, what would be your recommendation on the future use of biologics for CRSwNP?
Okay, one aspect I forgot to mention before that was really surprising to me was the effect sparing of systemic steroids, because the population treated with Dupilumab had a lower need of systemic corticosteroids compared to Omalizumab. This is a really interesting results that combined with all the outcomes that were demonstrated to be in terms of efficacy in favor of Dupilumab, it's really, really important, because finally we demonstrated that Dupilumab is one of the best choice that we have in the routine clinical practice actually for treat nasal polyps and asthma in combination as well. And another important remark that we should do is that the safety profile have been demonstrated to be similar between Dupi and Omalizumab. And this is very, very important as well, because these patients may need biologics long term, and Omalizumab have been considered for many years the most safe drug, because we have the longest data on Omalizumab, especially in asthma. And to know actually that Dupilumab has an overlapping profile of safety compared to Omalizumab is really, really important for the real clinical practice, because actually we can say that Dupilumab has a very good safety profile and a very good efficacy profile. And this is the perfect combination that we would have for a drug, especially if we should use that drug for a long time, as in these severe patients with asthma and nasal polyps together. And obviously, another point of strength that we should underline is that with the same drug, you can solve two problems for the same patient, and this is very important.
Eugenio, it's always very good to talk to you. Thank you very much indeed for your time. That's Professor
thank you.
Eugenio de Corso.
Thank you very much.
Well, joining me now is Professor Joachim Mullol. He is a EUFOREA CRS EPOS expert panel member. He's also director of the Rhinology Unit and Smell Clinic at the Hospital Clinic Barcelona and professor of research at the August P. Sunya Biomedical Research Institute, or IDIBAPS. Really good to see you, Joachim. Let's start talking about this trial. Can you summarize for us the findings of EVEREST?
Well, we currently have several biologics that are approved for severe and uncontrolled chronic rhinosinusitis with nasal polyps, with and without asthma. And we have done in these studies similar outcomes. All the comparisons that we have between these biologics are indirect comparisons. And the EVEREST, is the first head-to-head comparison between biologics in chronic rhinosinusitis without nasal polyps. And in this study, summarizing all the outcomes, favored Dupilumab versus Omalizumab, either outcomes from the disease in the nose, the size of polyps, olfaction, congestion, total symptom score, quality of life, or those outcomes in asthma, both lung function and control of asthma.
So you talk about it being the first direct comparison of these two drugs. How significant are the results from this trial?
Well, the main issues, as I said, for this head-to-head comparison is that these two drugs have been compared in the same population that we never had before. All were different populations, and inclusion of patients in these treatments, either Omalizumab or Dupilumab, were done in different populations. And that it's the unique comparison with these two drugs in a single population. This population, it's severe in the nose, and it's all of them comorbid in asthma. In previous studies, we had patients with asthma, patients without asthma. And in this population, all the patients have the two diseases, either in the lung, either in the nose. In addition to that, these patients included in the studies are difficult to treat patients. You have to understand that more than 80% of these patients had a previous surgery, and 40%, that is not usual because it's almost half of them, are aspirin sensitive. This is the most difficult patient to treat. And the comparison between these two drugs was not done only at the end of the study, but that was done in different time points, mainly at the first assessment, at the first month of treatment. This is an approach, very complicated, very difficult. It was not an easy study to do, but the results are very, very good.
I mean, so just in terms of this study, from what you're saying, clearly this study stands out for you. This is a very important study.
Yes, this is a very, very important study. EVEREST compares this study, and what we see that is more clinically relevant, if that is what you are asking me, is that there are three main issues that I could highlight from the findings of this study. One is that it's compared, both drugs are compared at the first assessment, that is 1 month after treatment, and after 6 months of treatment. not only to the end, but also to the beginning. The study of the main or the primary outcomes, which are the size of nasal polyps and the effect on olfaction, are found to be better for Dupilumab than from Omalizumab in all the subgroups analyzed, independently of the age of onset of the disease, the gender, the severity of asthma exacerbations, the presence of aspirin intolerance, the smoking history, the previous surgery that these patients had, the use of corticosteroids, or even the different levels of eosinophils at baseline, and also the FeNO at baselines, which are two markers of type 2 inflammation. In addition to that, to analyze the criteria of EUFOREA EPOS for the response to biologics, Dupilumab showed a better outcome than Omalizumab in all 5 criteria. The size of nasal polyps, reduction of oral corticosteroids, improvement in quality of life and olfaction, and also improvement of the disease in the lower airways, the improvement of asthma.
Finally, if I may just ask you, how does this trial translate into clinical practice?
In clinical practice, it translates very strongly because more and more we see patients affected in both the upper and the lower airways. And these are not different populations. I mean, we can treat these patients either for having a severe asthma or for having a severe chronic rhinosinusitis with nasal polyps. But we have patients from both sides. And these patients are very, very frequent. About 80% of the patients that I see in my clinical practice have both asthma and chronic rhinosinusitis. And we couldn't demonstrate that one of these drugs is better than the other, that sometimes we need to know that because we don't have success with all the treatments, is of great help in our clinical practice to decide which biologic should be used in specific patients.
It's always really good to talk to you. Thank you very much indeed. That's Professor Joachim Muller.
Thank you very much.
Well, what a fascinating and enlightening conversation with such important ramifications for patient care. Thank you very much indeed to my guests, to Professor Eugenio De Corso and also Professor Joachim Muller. Now, you can find more information about EUFOREA. You can also register for the EUFOREA educational events on the euphorea.eu website, where you can also sign up to receive the latest news via email. We're also on social media on YouTube, X, LinkedIn, Spotify, Instagram, and Facebook. Please do follow us. Until next time, goodbye.